house, feeling kind of shaky, baby.
My dad taught me how to play the guitar, taught me everything about music.
Running kind of slow, yes I was.
My mom is from a little town in Idaho. My dad is from American Samoa, so I get the best of both worlds. I get the island culture and I get the cowboy culture. My diabetes happened for me in my 30s. It was adult onset. For me, the symptoms were kind of crazy. I had to pee a lot. So when I had to go right then. Went to the doctor. That's how I got diagnosed. He said, well, your blood glucose is over 600. I said, okay. What's it supposed to be? And they said, under 100. I'm 6'5", 250 some odd pounds. At my worst, when it was uncontrolled, I was 172 pounds.
I knew before we started dating that he was diabetic. When we first met, he had kind of resigned to thinking that he was just going to have a short life.
I went in to see Dr. Patel. He looked at my numbers and he said, Troy, I should send you to the hospital right now to get your numbers under control. Don't set another appointment because you'll be dead. That dude saved my life.
When Troy came in, he was one of those patients that was in complete denial of his diabetes. It just got in the way of his life. It was in a bad place when I first met him. You got it for me?
Yep.
Awesome. So the typical patient comes into our office with very uncontrolled diabetes. Their sugars are 300-400s. They've seen their primary care doctor and they're frustrated. They don't know where to go next. Hey, Mr. Shah, how are you? The first step when they come in is setting them up with a diabetes educator, setting them up with a nutritionist, and then gathering information on how extensive the disease is. So when Troy first came in, the tools that we used was just a regular glucometer, and then we progressed to the short-term continuous glucose monitoring system. The grievances with the short-term sensors, the biggest one I see is that it just keeps falling off. And then the burden of putting it on every 10 to 14 days.
For the work that I do, I'm constantly in the car and I'm constantly on the road. So managing my diabetes becomes a juggling act. When the long-term continuous glucose monitor came out, it was a game changer.
We insert the sensor, so it takes about 10-15 minutes.
I lay down on the table, she makes a small incision, it goes underneath the skin, and within a day or two it's healed. There's no mark, there's nothing left behind. The important thing for me now is I get an alert, and it vibrates on my arm.
On the app, it'll predict, hey, you're gonna get a low, you're gonna get a high.
My typical week, wake up, check my phone. Is my number green? Cool, let's go. Make sure my transmitter's charged. Brush my teeth. Hit the shower. Hit my medicines. Make sure I hit my long-acting insulin. Hit breakfast. Get in the car. Hit the road.
The patients are more educated about what's happening to their sugars during the day, when they're sleeping, when they're stressed, during exercise. And we have that information now as well. Having those better conversations and looking at the data, has become much easier to treat diabetes.
His glucose numbers started coming more in line. It lasts for 6 months, and that's huge.
Managing my diabetes has to do with our long-term being together.